Are you a medical student or a foundation doctor at the start of your career? Well, welcome to this conversation. I'm Dr. Zoe Williams. I'm a GP and proud to say that I've recently been made an honorary fellow of the Medical and Dental Defence Union of Scotland. And today we're talking about something I think every doctor remembers very, very clearly. And that is when you first go from being a medical student to a fully fledged doctor. So I'm joined today by Dr. Mel Azati and Dr. Vinci Pabellin, who are both foundation year doctors. So thank you both for being here. Life must be pretty busy right now. So I'm taking it today's your day off. You didn't manage to get study leave for this conversation?
Unfortunately not, no.
Didn't think so. So before we get into the more serious stuff, I want to start with something straightforward. When you think back to your very first week of being a doctor, what would you say surprised you the most about the job?
Thank you for having me, first of all. I'm really excited to be here. Thinking back to when I first started in that very first week, I think what shocked me most was the absolute transition it was, switching from being a medical student, albeit we'd had assistantships telling us, this is your chance to have a go and get into the flow of it. But starting and logging into the systems for the first time, trying to figure out how to order blood tests, let alone just take the blood tests and find all the equipment for them. It was all a very, very slow type of tumble through the job. And I think that shocked me very much because I thought when we start, that's it. We get to be doctors. We ask patients how they're doing, if they're, passing bowels or not, and doing the doctor stuff. But actually the day-to-day of it, the working through the systems, all of that stuff was really hard to get to grips with. At the same time, you're meant to pick up the flow of the last doctors who had a year worth of training almost immediately. So I feel like the expectation was there, but maybe I wasn't quite ready right then on that Wednesday morning to start and pick off from my peers, really.
I guess it's so true, isn't it? Because at medical school, that's the bit, all the admin side of the job, you're not prepared for. And just so you know, I recently started working in a different GP practice in a different area. It continues throughout your life. If you move jobs, you've got to learn the new systems, learn the new, in this part of the world, we don't refer to A&E this way. You've got to write a letter. So the admin side can be, you, as you go through your career, you really do hone that skill of how you communicate. But yeah, the admin. Oh. What about you, Vinci?
I think definitely I could really relate to what Mel was saying with the expectations of being as smooth as the previous F1 who was there. For me, I really remember my first day just because I was the only F1 in the general surgery department.
Oh, wow.
I was in a rural hospital.
Okay.
And the rest of my seniors were having like this induction and I had to join them after midday. I had a lot of pressure to do all the usual ward jobs.
So you were
in the morning.
The only doctor on the ward?
Yes. And I was told I had a senior somewhere in the hospital that I could call for help. And so I was ready to hand over things, obviously, when the time was right. But I just felt like there was so much responsibility to get everything done by lunch.
Yeah.
And then I went to the induction, had a good time. I had this pit of anxiety in my stomach after the induction, and I was like, I've got to go back to the ward. I know it's home time, but I'm scared I've missed something. Yeah. I was just on my own all morning. And then my colleague gave me this really wise advice saying, the hospital will run without you. When it's time to go home, go home. Yeah. There's the right precautions. There are seniors transitioning for the night shift. It'll be fine. And I think it really helped calm my nerves.
Yeah.
So I found that really reassuring.
Yeah.
And
You need those. Those are the bits, the little nuggets of advice that will stay with you forever. And even when you get to where I am now, we were chatting just before we started recording, and I realised that my first day on the wards was 19 years ago. Oh, I'm so old. But yeah, I can still remember certain people over the years who've given those little nuggets of advice that, now it's for me, it's about family and always saying yes, and actually you've got to sometimes say no, but not think about what you're saying no to and the guilt that comes with that and the responsibility. It's like what you're able to say yes to because you said no, which for me might be putting my son to bed or something like that. I remember my first week so clearly. So I was up in Newcastle at the RVI hospital, and my first job was respiratory medicine. And I think the key thing that I learned in those first few hours, actually, days and weeks, was that it's not the doctors that run the hospital. It's not the doctors that run the wards. It's the nurses. They've been there, some of them, for decades, and they know your job inside out. So, yeah, making friends with the nurses, being nice to the nurses, helping make the nurses' jobs a little bit easier, and they'll do the same for you. Have you ever found yourself saying something along the lines of, I just wish somebody had told me this before I started? Anything that came a bit of a shock, bit of a surprise, and you think, why do they not tell me this? I know when you become a mum, there's loads of stuff you're like, why did nobody tell me about this? But what about when you became doctors?
I think for me, again, it's going back to the cognitive load.
Yeah.
Because I think as a student, you're just sat there waiting to either be quizzed or offering any help. And I guess as a student, I didn't really appreciate how many thoughts are firing in my seniors' heads and stuff like that. So, but I guess that's part of the job. So I guess you've got to anticipate that in some sense.
And I think you shift from, as a student, the job as a student is to know everything you can be examined on. But when you become a doctor, you can't know everything. I think it becomes more about knowing where to go to get the information that you need, and having had that baseline knowledge guide you as to how best to get this information. Or actually, is this not for me to know? Is this for me to hand over to somebody more senior in another profession? I think it's worth mentioning at that point as well that MDDUS have on-demand CPD. So what's great about that is as you come across things, you identify gaps in learning, the resources are there online that you can access, particularly resources around difficult situations, communications, anything that could potentially lead to a complaint. If you found yourself in a bit of a tricky situation, there's loads of CPD that you can go and recap on, which is helpful.
Honestly, if I was to say something that I wish I had been told before I started was, although the hospital has all of these systems in place now, a lot of things are EPR referrals, so sending things through the computer systems, that the art of human contact is still not lost. Within the hospital particularly, it's a great way to get things done is to actually go seek out your radiologist. Please don't see them every single day, but when you do need them and you need them urgently, is to actually seek them out. They're in the hospital, and that personal touch and that human connection you don't usually get to know. So I think I wish somebody had told me that earlier, is that if you need something, just go find them and go have that conversation with them, because they will say yes.
It's hard to look somebody in the eye and say no, isn't it? When you're just trying to do right by your poor patient.
And you're like, I'm just the F1, and you see the plead.
So I think it's a massive step when you find yourself with the real responsibility instead of just the theory that you're taught in medical school. So did either of you have a moment early on when it really hit you that you are now actually the doctor in the room, not just the doctor amongst your friendship group or the doctor at home with your family, but you're really genuinely the doctor in the room? Was there a moment?
I think in my very first week, I started on night shifts on the weekend. So weekend night shifts on general surgery was my very first incoming doctor. And there was a patient who I was called to see by one of the nurses. They were worried that they'd been vomiting all night. So going to the patient, I had to look up everything, because I was like, what sort of history do I need? What sort of treatment can I give? And I was very new to everything.
How do you look things up nowadays? Because we used to have a book called a cheese and onion book and a salt and vinegar book. Cheese and onion was for medicine, salt and vinegar was for surgery, just because it was blue and we'd have it in our pocket and we'd have to look it up. Presumably you don't do that anymore.
No, we just ask our good old friend Google. Geeky Medics is great for histories now. They have really great way of asking patients questions and actually understanding why things are happening. So why are they
Okay.
vomiting? So I went to see this patient, and bless them, they were lying in bed. They looked really poorly. They had sick bowls all around them. And I got to ask them the history. I got to lay out a plan, and I got to think about what I can do for them. And in that moment, I felt I'm the doctor in the room, because I get to make this decision. I get to choose what they have, and the responsibility is truly on me to do it right. And I think that's when I felt like the doctor in the room.
Yeah. What about you, Vincy? Was there anything that strikes you as that moment?
Definitely in my first week, it was just the usual afternoon jobs in general surgery. I was just chasing some scans, and then I was just going through one of them. I didn't think I'd see anything, because what am I going to see? And then I saw like a renal stone, and like measured it, and I was like, oh, this looks a bit big. I might just call Glasgow, the nearest specialist centre, just to see what they think of this scan. And then I did, and they were interested in it, and they gave some advice, and I think they were interested in the patient, send the patient to us.
Oh, wow.
And then I think when I got off the phone, I was like, oh, I just did that.
Yeah.
I just did that.
Yeah.
Oh, amazing.
I didn't think like me just like casually scrolling through some scans.
Yeah, yeah.
And then I updated the patient. I said like, listen, I thought I saw a stone in your scan. Glasgow are happy to continue your care. And then I just updated my consultant who, and I was just so surprised.
But
like,
your consultant was
amazing.
thrilled,
yeah.
because not only have you done all the work, you've also managed to reduce his caseload by one.
Yeah, I think that's what he was mostly glad by. Like, I wasn't calling in like, oh, I think I saw something. Do you want me to call Glasgow?
Yeah. You just did it. You
yeah.
just took initiative. Because that's quite scary. Because if you're then all of a sudden you're a junior doctor, like F1 doctor, and you're phoning a consultant and they're picking up the phone, and I know I don't know if they're still as mean as they used to be, but certain doctors would like a history to be presented in a certain way, or you'd feel like they'd ask you a question that was completely irrelevant, but just to check if you knew it. And do they still do that?
Sometimes.
Do
yes.
they?
I've been yelled at during shifts. Took it really well, I think, for myself, and they calmed down by the end of it, because they realised what they thought wasn't relevant for them was actually relevant for them.
Yeah.
So the
Don't tell me I'm not interested in X, Y, Z. Just tell me
give me your name and GMC number. I'll be in touch with your supervisor in the morning. I've had that.
Really?
But it still happens. I think it's a lot less common, because I've had a lot more good phone calls with people than not. So, but there is the odd one, and you just have to realise that it's not maybe directed at you, but actually maybe part of a wider thing. I don't think it's good to tolerate, but I do think that it's nice to just understand, sweep it under, keep moving.
You always remember, I mean, I still to this day remember the consultants who, you don't remember the ones so much who, you remember who was mean, but you don't remember why they were mean, but the ones who were kind. I remember when I was working on general medicine on the weekend, and we had 2 care of the elderly wards, as well as that were in a separate wing of the hospital to the other wards that you were covering. And on a weekend, practically every patient on both of those wards needed blood, and there were meant to be 2 F1 doctors covering medicine. So I'd gone in one day and the other doctor was off sick. So I think I had to start my day by going around and taking blood from 24 people before I even could get to anything else. And I thought, this is just not doable. And the care of the elderly consultant would always pop in just for an hour on the weekend to see her patients. And I remember her saying, oh, Zoe, this won't do. She's like, right, rolled up her sleeves.
Oh, wow.
She couldn't use a butterfly needle because she'd never used one. She's like, if you could find me a good old-fashioned needle and syringe, I'll come round and help you. And I'll never forget that. What's been the scariest thing that's happened so far in your careers? Is there anything that comes up as, gosh, I wouldn't want to live that day again, or maybe it was a bit of a near-miss incident?
I think I can remember on my nights, I was filling in a gap because a senior colleague had called in sick. So usually at my hospital as the F1, you have less responsibility. And so, of course, I wanted to offer my help as best as possible. So I had a little bit more responsibility. I was called in, there was an emergency going on. And I think at the moment, like, I was just really checking myself, like, Vincy, don't freak out. Like, you could, like, immediately freak out, like, at any point soon. Just don't, like, I was just, like, really telling myself while I was going, like, managing through this. Because I was so aware of the situation at night. Like, there's less staff around. I was more or less on my own on the
Yeah.
ward right now. But I found reassurance in that I was able to call the MedReg for further assistance and further advice.
Yeah.
And I worked through it systematically. And
You're like the perfect doctor, aren't you?
Sorry.
That's like an exam answer. That's an interview answer. Well, at this stage, I would just give myself a little bit of coach here. You got this, Vincy. Contact my registrar. Work through it systematically, like I've been trained.
Yeah,
but
I
you
think
did that. This
it
is where
was-
the training does come in,
like,
doesn't
yeah.
it?
And I think I was just so proud of myself afterwards, because I kept like second guessing myself, like, oh, did I do this wrong? And because in the morning afterwards, I had to hand over to the day team. On hindsight, so basically, I was really anxious about why they were giving me such a funny look while I was like handing them over this emergency I was dealing with. And then I remember coming home and I was like, oh gosh, I must have mismanaged that. They were looking at me like I was a moron. And then on hindsight, I was like running up and down the stairs. So I was like talking to them out of breath.
Yeah.
So they were probably just like, why did this guy just run a marathon or something?
Yeah.
And it was nice to get the assurance from them the night later that the patient was fine. And yeah, so I was really proud of that moment. But yeah, probably the scariest moment I've had so far. I felt the most like alone.
Yeah.
And it felt the most challenging.
It's interesting how it's that questioning comes after, isn't it? Because in the moment, that's when your training really does benefit you, and you are able to. You've been taught to use the system and to escalate to someone more senior, but it's afterwards. It's in those moments after you've walked out the hospital, you think, oh, I did it all wrong. I must have done it all wrong. The way they looked at me, and you start second guessing. But then you come back in and you get that assurance. And what about for you, Mel? Anything that's gone terribly wrong?
I think it's a similar setting as Vincy. It was a night shift that I had taken on.
It's always the
and
night shift.
It's always a night shift, and it was one that I had taken on because there wasn't an SHO to take it. So usually we have an F1 and an SHO over the night. And we were taking care of all these wards of surgical patients, and we had one patient who came up with an emergency, a major hemorrhage protocol, another one who was also bleeding, and another one who was also bleeding. So at the same time over the night, we had 3 bleeding patients. And as you know, there's so much to do when you've got someone bleeding actively. And each one of those patients we were managing as F1s to begin with, seeing how urgent was this. And one of them ended up being very unstable. We'd obviously escalated up the right path. And the other one, just as we were finishing our night shift, coded. So everyone medical alerted towards this patient, and it felt really scary because all through the night we'd been looking after and stabilizing these patients, and for one of them to have a medical alert, I was like, did we do the right thing at the time? Like, did we look after them correctly? And it turned out we had done everything right.
Yeah.
But obviously with them losing blood and with it just getting slowly worse, they'd had that alert. And handing over, we had so many of the seniors coming in, just starting their day shift, and saying thank you for getting them through the night, because this could have gone wrong a lot earlier in the night, and at least now we've got everybody here and we can help properly. But it was one of those patients that didn't fit into any specific box of responsibility, and it was so hard to find the right help for them. And thankfully, having enough contacts within the hospital, knowing the medical registrar, knowing the surgical registrar, we were able to help the patient as best we could until the right people did come. And it was very scary that night, because thinking at any time any of these 3 could be a massive problem, and not necessarily knowing exactly what you can do to jump in right in that moment, knowing that there's these safety protocols and all these protocols, but before they get to that stage, they're your responsibility, and to know to do the right thing for them at that stage is really important, because it might be the difference.
It's really, oh God, it's just taking me back to how scary it is. It really is quite scary, and especially when you've got multiple patients who are sick at the same time, it's a lot. It's a lot. You know that MDDUS members can contact them anytime if they're in a difficult situation and need advice. It's worth knowing. I mean, I feel like I should share something at this point. Night shift, A&E. And it actually wasn't a very sick patient, but I think it was my last night shift of however many we used to do. I can't remember. How many night shifts are you allowed to do in a row at the moment?
4.
4. Yeah, I think we used to do 6. And it was a lovely patient who was visually impaired, and he had a paronychia, so an infection of the nail bed. It's something I've treated many times in A&E. So you numb the finger by putting an injection on each side. So you numb the digital nerve on each side with an injection of local anaesthetic, and then that means you can cut and squeeze out the pus, and you can clean it, and you can manage the infection. So I took this patient into a side room, and he had a guide dog with him and speaking to the dog. So I went and did all my bits, sterile environment, all of that. And as I started I put in the first injection, and I could tell he sort of sat back a little bit. I said, "Is everything okay?" He said, "Yeah, fine." I put in the second injection on the other side. I turned his hand over, wrong finger. This was at the point I thought I could be in trouble here.
Oh.
This is where communication comes in. It was a genuine mistake. I don't really have a good excuse as to why it happened. It was one of those things, a genuine mistake. I apologised profusely to the patient, got my registrar to come and, do the procedure, and he never complained, and he was lovely. But that's probably a moment I should have called MDD-US in that moment. But yeah, I think, I guess I'm fortunate that's the mistake I made, and it meant he obviously suffered unnecessary pain of 2 injections, but nothing like really serious came of it. So I think medical school is amazing, and it prepares you for so many things: how to communicate, how to diagnose, what investigations to do, how to manage patients. But there are also so many things it can't teach you, things that you can't learn until you're on the job. I think, Mel, you've already shared one of them, which is all the admin side of things, like how you actually order the test. I'm guessing you don't have fax machines anymore either.
No.
But no.
What's a fax machine?
But what can you think of something that you remember learning on the job that you could have only ever learnt on the job, Vincy?
I think for me, it was definitely the sense of firefighting, especially when you get those days where just overlapping unfortunate factors, and there's just so much to do. There's some unwell patients here, some all right patients here, and so many things to do. And I think I wish I was more aware of this, but I guess you can't really just go to a medical student and go, listen, one day you're going to be so stressed out of your mind because you have to do 100 things. But I guess it's just experience. Like, with more time and with more experience, you just become more accustomed to that feeling of firefighting. And I think looking back, I would just tell myself that all you need is good organization skills to really sift through what's the most important task and make this firefighting more doable.
Yeah.
And a nice deep breath always helps.
Yeah, absolutely. Wow.
Something that I have noticed that I only really learned is prioritizing myself during the day, because as a medical student you have a lot of gaps in your day where you can take your breaks. They're pretty well structured, but as a doctor nothing is structured, and if you go the entire day not getting up from the desk and doing notes, no one will say, did you stop for lunch? I mean, some of your colleagues may notice, or you may notice them leaving and you're not, but I think that's something I had to learn to almost put in as an alarm, like 12 o'clock, if you haven't eaten, maybe go do that and take a bit of a moment for yourself. It's very easy to forget that. And no matter how many people tell you, remember your water, remember your food, it's very easy to forget. And it's something that you have to learn for yourself once you start. Yeah,
you do. I remember my first ever set of surgical on-call nights as an F1. And it was one of those nights, there was lots going wrong, loads of sick patients, and I had a long list. Do you still do like the little box and then you tick it?
Oh,
yes.
Yeah.
Yeah, we still have the same little shorthand. And every time that this list would go down, every time 2 went off the list, 3 would go on. And I remember there were so many sick patients that I was doing the rounds every hour. There were a number of patients who had to check their urine output, post-surgical patients. So monitoring urine output. And I think it must have got to about 4 o'clock in the morning. And one of the nurses on the ward said, "Can I get you a cup of tea?" I'm like, no, I'm fine. She said, "Can I just ask, what's Mrs. So-and-so's urine output?" I was like, "Oh, it's fine. It's, 80 mils. She said, "What's your urine output?" I said, "What do you mean?" She said, "You've been working for 6 hours. How many times have you been to the toilet?" I was like, "I haven't." She said, "Sit down. I'm going to get you a cup of tea." And it was that moment of realisation that I hadn't stopped. I hadn't had a drink of water, hadn't been to the bathroom, hadn't done anything except run around like crazy. And I think that was the moment it set in for me. You do have to prioritise your own self-care, because otherwise, well, your patients don't get the best out of you by the end of the shift. And you risk burnout. It's not good for your own mental health. You end up being offset, lots of problems down the line. I think resilience, sometimes people think of resilience as, I can go harder, I can push through. That's not what resilience is. No. Resilience is recognising your boundaries, finding time for self-care, knowing what your own personal needs are so that everyone can benefit.
Definitely. It's a responsibility to your patients and to yourself, really, because you can't be that good of a doctor if you're running on fumes.
I think that's a good time for us to sort of start to talk a little bit more about mental health. And I know that younger people like yourselves are now much more open about talking about mental health than my generation. I hate saying that. It makes me sound so old, but it's true. So being a foundation doctor can be incredibly rewarding, but also quite intense. And so much is outside of your control. And all of a sudden, you're still very young, but you've got all this responsibility on your shoulders. So how do you and your colleagues talk about your mental health? Do you check in with each other? Do you feel that you can talk openly if you're not coping, if it's feeling a bit too much? Or is it still like it was in my day, sort of very stoic and people sort of head down and get on with it?
I definitely think there's been a big shift. I think when working right there on the ground, we're all very open with talking about how we feel, our stress levels. The weekend that I was just on my SHO, I would just check in on him. He wasn't having breaks, and I was like, "Listen, I'm going to go and grab you a wrap, and even if you don't want to talk." So I think everyone there's like a better sense of camaraderie. Right. Everyone's looking out for each other a bit more, from my experience, and we all talk about it. But I think one thing that's really interesting whenever I talk about it with my friends who I graduated with, and we're all working doctors, is like this guilt of calling in sick when you are feeling sick. Yes. I think like it seems to just add on to like the anxiety of in relation to resilience and like powering through. So I think that's like an interesting thought that that I've noticed a bit more. That causes undue stress when you're already physically not feeling the best.
Yeah, you can end up feeling the weight of the burden because you know that if you're not there, there's more work for everybody else. Whereas it's not your fault. It's the system should have capacity to be able to deal with that. But unfortunately, it doesn't it? No. Yeah, no, I get that.
Yeah. I think likewise to what Vincy was saying, there is a massive shift, and I think it is apparent in my team. I think maybe to some extent having junior doctors or resident doctors having offices has made a massive change. It's part of... Yeah, that is a new thing.
Who has an office?
We have an office now. We went from a very small room where we didn't actually fit, and a lot of us had to work around on the bays, taking nurses' spots, getting kicked out of nurses' spots, to now it's become a shift to junior doctors, resident doctors having offices. And
so we're not talking about the mess, the doctor's mess here. Yeah. This is an actual place that's for you to go and sit down with a computer.
Yeah. And it's specific to our ward. So my endocrine and diabetes ward, we have our own doctor's office. Okay. And I think it's part of the general 10-point plan for doctors is to have these spaces, like having better wellbeing spaces, having every doctor should have an office and all that. And it's like a nice communal space for us as the residents to work. And I think having that private area where the doctors sit allows us to have those conversations during the day, checking in with each other, because we can just glance over, see, somebody's looking stressed or they're coming in and out of the room. Do you need a hand? And have you had food? And yesterday I had quite a lot of sick patients, and I didn't even finish my ward round all day. And because everybody was there and they saw me coming in and out of the room, somebody brought me biscuits during lunch. I didn't leave. Somebody else, one of my SHOs, came and helped me see some of my patients. And I think that having that office really did change the game, as it were, for us in our mental health. We have a lot of checkpoints during the day where we get to talk about what's bothering us, how we're getting on, if there's something that we need some help with. And I think it's been like a great shift in the energies in work.
I just took a moment to reflect then on, as you're talking about that, I'm thinking, this is great, this is amazing, this is what doctors need. They need a space where they can do their work around other doctors, where they can support each other. And as I was thinking that, I was thinking how bizarre that would sound to probably somebody who works in pretty much any other industry.
Yeah, you're
that
right.
I'm overwhelmed with joy that you actually have your own place to sit and do your work. You're not having to boot, and because if you're sat in a nurse's spot, they get quite angry. We've already talked about how important it is to be on the right side of the nurses. I mean, it's the least you deserve, really, isn't it? But I'm glad that
I don't think we would have even realised that would make such an impact on mental health, for example. Like, you think it's actually just practical, having a computer set up and having everything, but actually it's done miles more for us as doctors than just having somewhere to sit and work. And
I think the fact that you're in an office as well, away from both patients and other members of staff, means you can actually get on with things. Because I remember often our computer spaces that we could get work, they were on the ward, sort of tucked to the side of the ward. So whenever you were trying to do something, there'd always be somebody passing by, or can you just do this, can you just do that, or a relative who would say, oh, can I just ask you a question? So it was really difficult to actually, especially the bigger tasks or things that needed a bit of thought, you'd often be interrupted, and the mental load that you already carry, the number of tabs open that you already have as a junior doctor, you do just need a bit of space, don't you? And a bit of quiet, a bit of thinking space every now and again. Are you watching The Good Doctor?
Oh, I'm scared to watch
on Netflix.
that.
No.
Why?
I don't know. I feel like ever since becoming a doctor, it just hits too close to home and to your everyday. So I try to avoid. I watch very much comedies, like romance and dramas, and I try to brain rot essentially when I go home.
I think all medical dramas, they're all like lies. None of them are really accurate. So on The Good Doctor, I love it because it's about this doctor who's autistic and he's amazing and brilliant, but also has lots of challenges, obviously. But they're this team of surgeons who literally do every single type of surgery you can imagine, from babies through. It's like no surgeon's going to have that range of skill. Like literally everything from burns down to transplants. So not watching any medical. I still think Scrubs is the most accurate of all the medical dramas, actually, especially the relationships. Sort of how the sort of janitor has been there forever and knows everything. So if you're not watching medical dramas, what do you do? What do you do outside of work that helps you unwind or after a tough shift?
I love to bake. I love cooking.
Did you bring any cake today?
Unfortunately, not. I don't think it would have lasted on the plane. Unfortunately, fair enough. A few. And I just really enjoy. I enjoy being in the kitchen.
Oh, nice.
Just getting stuff done like bit by bit.
Yeah.
But I also love baking because it brings people together. Love a baking rota. We've got one right now in Gastro.
Have you?
Yeah.
Oh, awesome.
Baking rota.
Yeah.
Oh.
What a good idea.
Yeah. So it's always nice bringing in cakes. But also, it just adds a new level of anxiety for me. Like, oh God, what if they hate it? Or like, oh God, what if they find like one of my cats has
extra protein? Reminds me of the trolley we had in A&E. If you were on nights, because there wasn't really time to take proper breaks, so everyone would bring something in for the trolley, and we had this trolley in one of the offices that was on the ward, and you could just nip in there at any time. But it meant it was just like sort of sweet stuff, cake, crisps. Sometimes we'd order in pizza. It wasn't nothing healthy on there, but Yeah, the trolley was a bit of a godsend. What
That
do you get up
reminds
to,
me.
Mel?
I go to the gym when I can. I'm probably not as good as I was, but it's definitely something that helps me unwind. And when I do go, I feel more powerful and I feel fresh, which
Yeah.
is great. I love a bit of movement. Otherwise, I think I do just love to have some time by myself and sitting almost in my own company, unwinding mentally and reflecting. And then I call my mum and I
Aw,
undo all of my
yes.
reflection onto her. So I think
Offload onto
that's
mum.
my evenings. Yes,
Yeah.
a bit of gym, a bit of good food, like making some home cooked food, and then talking to my mum.
Yeah.
And that's like my week. And then I get to come to London sometimes and see my family too, which is awesome therapy.
Yeah. I think it is so important, isn't it, when you've got a job like ours, that you find something that does help you unwind, de-stress, whether that is speaking to mum or a friend or baking or exercise. It's really important that we carve out the time to do that, because if we don't look after our own well-being, then, as you said at the start, it's about prioritising yourself, isn't it? And MDDUS provides its members with wellbeing support as well through an independent and confidential support service. So there's extra support there as
Yeah.
members, as you both are, if you ever need
Definitely.
it. So Mel, Vincy, thank you so much for this incredible conversation. It's been a real pleasure talking with you. And also thank you to the Medical and Dental Defence Union of Scotland for bringing us together to have this wonderful chat. To find out more about the support that MDDUS offers medical students and foundation doctors, go to mddus.com.